Okay, we're going to begin with a few postural stretches before we start our level 5 postnatal cardio burst. We're going to need our foam roller and we're going to roll out our hip flexors. The hip flexors are located around the groin. I'll show you so you can see that the area you want to roll. You'll roll one leg at a time, starting with your tighter or dominant leg. And you can have your non-dominant leg out to the side in a butterfly position where the knee is on the floor, and you can pad it with, some cushions, or roll your mat up so that there's not a lot of pressure. And as you roll into this area, just make sure you're not pushing your belly out, that your belly's firming in towards the spine. You're pushing down into your forearms actively, engaging the lower abs, and working into that tissue that can be pretty sticky and tight. Make sure you're exhaling the air out, inhaling laterally with the belly braced in towards the spine, working on those Kegels with each exhale, lifting in and up on the muscles that stop your stream of pee. And another few breaths here. And let's move to the non-dominant leg. Walking forward and back, finding spots. You can do a little circular motion. You can walk crawling forward and back. Just find the area that needs the most attention and see if you can breathe into it without allowing the belly to relax down, because we don't want to put pressure on the low back. So belly pulls in like you're putting on a tight pair of jeans, actively lifting in and up on those muscles that stop your stream of pee to recondition the lower pelvic floor. Just another 2 full inhales and exhales, bracing the low belly in and up. And let's slowly make our way over to a wall to stretch out the front of our shoulders. So we're going to bring one arm, face the wall, bring your dominant arm into a high V, keep a soft bend in the elbow, and go ahead and twist away from that arm, stretching out the anterior delt. Breathe here. Inhale 1. And exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. And let's switch sides. Going to the other side. Twisting away from the arm. Hold it here. Inhale 1. Breathe. And exhale 1. Inhale 2. Wall V stretch. Exhale 2. Inhale 3. Exhale 3. And let's let that go. We're going to set up. So it'd be my advice, if you have plantar fasciitis, shin splints, or diabetes, to wear tennis shoes. We're going to set up our stair stepper with 2 levels. So it'll be the higher level for level 5. So I'm going to give you a moment to set the stair stepper up, to put your green loop band around your outer thighs, to grab your purple loop band for your upper body. You can put those sneakers on. I know it takes a second if you're using a stair stepper to make sure that the risers are secure and that when you step up, it's not going to shake because they're on properly. So take that time, set yourself up for success. So our breaks for this level are only 20-second recoveries. So the loop band goes on your thighs all the way above the knees. And we're going to bring the purple loop band around our wrists, keeping our elbows bent. We're going to be traveling up and over the stair. If you're using regular stairs, you'll be stepping onto it in the frontal plane, stepping up and down. So profile to the stair. So standing profile to the stair, you're going to step up and down. So going up and down. And as you go up, the arms go overhead. So arms go overhead and you pull out on that band. And you keep going. So if you're on stairs and not on the stair stepper going up and over, you'll switch sides when I let you know to do that. But you don't need to do it yet. Stay on this side. Get comfortable with the movement, either up and over or up and down. Now the arms lower and lift. They lower, the elbows bend and you lower them, and then they lift. So the band is right in front of the face, and then they go up. So I don't want the arms extended out because that's a little too much pressure on the front of the shoulders. Keep that going. Go ahead and switch sides if you're on stairs. If you're on a stair stepper, you don't need to because you're going up and over on each side. Make sure your legs are perfectly parallel. And also that you're looking up a little higher than eye level, finding something to focus on as you go up and down, keeping your hips square. Okay, this is our first exercise. grab your 5-pound weight for our second exercise. You'll hold it at your chest. We're going to do up and around. So you're going to start profile to your stair, and then you're going to step up onto it, square to 12 o'clock. So if you're at 3 o'clock, you go to 12 o'clock, and then you come back down on 9 o'clock. So it's just up and around. So we step up onto it the normal way, and then back down the other way. Up and around. Keep breathing. As you're doing this, you'll alternate sides so the leg closest to the stair is the leading leg, and the arms are going to press overhead every time you step up onto that stair. Keep breathing. Inhale and exhale, just learning the movement. And one more time. Okay, our final exercise. We'll need our red loop band and our 5-pound weight. Start with the weight in your dominant hand. Take your hands through that red loop band, so it's around your wrists. You'll pull out on it. Your arms are going to go up into scaption where the wrists are slightly below the shoulders when you step up onto the stair. So if you're right-handed, your left leg leads. If you're left-handed, your right leg leads. So the opposite leg steps up, and then the other leg steps up. Arms come up, and then the same leg that stepped up first goes down. Correct. And so we're leading with the opposite side of the loaded side. Up and down. So I'm left-handed, so I'm going right, left, right, left, right, left, right, left. If you're right-handed, you're going left, right, left, right, left, right, left, right. Now, don't get momentum going with the arms. Pull out on that band. Feel the abductors of the arms, the triceps, the posterior delts. Make sure the wrists don't go above the shoulders. Plug the shoulders down. You can switch sides if you haven't, just to feel what the other side feels like. Make sure you're not dropping your focus each time. That's not great for the neck. Lift the chin, engage the neck flexors, keep your focus up a little higher than eye level, and keep pulling out on that band, feeling the abductors of the arms, feeling the abductors of the legs, rebuilding those hamstrings, lateral hamstrings. Excellent. Okay, we know our exercises. Grab a sip of water. I'm just going to demo the first one again so that you're familiar with it. We had the purple loop band around the wrist, and we're just going up and over or up and down if you're on a regular stair. Stay on one side for the full minute, and then our next minute you'll switch sides if you're on a stair. Up and over, you're going to do the same side because you're going to hit each side. Okay, setting up, counting you in. 5, 4, 3, 2, here we go. 1 minute on the clock. Up and down. One of the biggest things I see is the creeping shoulders, so plug those shoulders down. See how engaged you can get your upper back here. As you pull out on that band, you'll feel the arms usually, but if you can think about the back ribs puffing back behind you to the wall, just engaging your shoulder blade anchor more, that's going to be great to combat kyphosis as you're breastfeeding. Keep the chin lifted. Keep your gaze soft and a little higher than eye level, or even if you're not breastfeeding, perhaps you're carrying your baby a lot and that's causing some rounding in the front of the shoulders, and we want to combat that. Hang in there just another 20 seconds. Make sure that you're stepping onto a perfectly parallel leg, not turning the foot out from the ankle joint, keeping the knee soft. Don't lock the knee at the top. Almost there, 10 seconds. Push through it. Make sure that focus is up higher than eye level. Counting you down. 5, 4, 3, 2, 1. Take your 20-second break. It's going to go by real fast. Don't take the band off your thighs. You can take the band off the wrist for a second. Grab water. Take a stretch. I'm going to tell you when you have 10 seconds. You have 10 seconds. We're going to turn around and hit the other side. Same exercise in the frontal plane, but if you're on stairs, you're going up on the other side. Here we go. 5, 4, 3, 2, and 1. 100% effort. Full minute on the clock. Good. Pulling out on that band. Keeping the focus up higher than eye level. Perfectly parallel in our legs. Soft bend in the knees. Shoulders plugged down, chin up. Imagine my hands hovering from your shoulder blades and you're trying to reach your back ribs to my hands, engaging the upper back. Lower abs are in. Watch out for overarching your back and rounding your back as you step up. Find somewhere between an arch and a rounded position for your pelvis to stay in with the belly firm in towards your spine. Each inhale as you press those arms overhead, feel your pelvis pull down towards that stair. In opposition, lengthening your QL and side body. Each exhale, let your inner thighs pull you and control the descent. Inhale, pelvis pulls down in opposition of the arms. Exhale, inner thighs pull you down so that you safely lower with the bend in the knees, engagement in your adductors as well as the abductors of the legs. Counting you down. 5, 4, 3, 2. Take your 20-second break. Grab water. I'm just going to demo the up and around with the 5-pound weight on the chest. So we're going up and around. The weight goes overhead as you step up onto center. So we're going from 9 o'clock to 12 o'clock to 3 o'clock, back to 12 o'clock to 9 o'clock, up and around. Counting you in. 5, 4, 3. Hold that 5-pound weight at your chest. 2 and 1. You don't need the loop band, just the 5-pound weight. And up and around. Good. Breathing into it. Go, go, go. Taking your time if you need to. Make sure you plant those feet solidly and that your feet are perfectly parallel when you step up. This is a chance to work on your ankle strength and your alignment for your knees safety. As you press overhead, plug the shoulders down. Again, as you step up and press overhead, pelvis reaches down in opposition. Your obliques engage. Those are your outer abdominals, the outer abdominal wall. We want them long and strong. Continue on. Just 20 seconds to go. How quick can you go without experiencing joint pain, without using momentum? Where's your focus of your eyes? Is your chin lifted? Is your gaze a little higher than eye level? Hang in there. Push yourself. Counting you down in 5, 4, 3, 2, 1. Take your 20-second break. Remember, it's going to go by quick. Get water, any stretch that you need. I'll let you know when you have 10 seconds. And we're at the 10-second mark. If you want to get set up, holding that weight at the chest, soft bend in the knees before you begin. Check your feet out, parallel, counting you in. 5, 4, 3, 2. Here we go. Take it up and over. Same exercise. Up and over. Good. Breathing into it. So we get 2 sets in of each exercise at 100% effort, 6 full minutes of cardio bursting. The National Heart Association recommends somewhere between 4 and 8 bursts with a 3-minute warm-up, which we did when we learned the exercises, and then a cool down. You'll finish up with your flexibility that's safe for your abdominals if you had, so we don't have any rectus abdominis splitting, which we don't want. So we have to be careful about how we stretch postnatally. Continue on, push yourself. Go, go, go. And 5, 4, 3, 2, 1. Take your break, 20 seconds. Don't do the exercise. I'm just going to demo. So we're going up and down this time, holding the weight in our dominant hand, and then the opposing side will be the leading leg. I'm left-handed, so I'm going right, left, right, left, right, left, right, left. I have my red loop band around my wrists, and I'm holding the 5-pound weight. And here we go, taking it up. Arms go up to scaption. So only in line with the chest like a frontal raise. We pull out on that band as we go up. And if you're right-handed, your left leg leads going up and down. If you're left-handed, your right leg leads going up and down. Plug the shoulders. Stay on one side. Don't pass the weight. We're going to do a full minute on this side. And then you'll take your final 20-second break before our final burst. Hang in there. You're doing great. Push yourself. How hard can you go? How fast can you go? Keeping those legs parallel, keeping those knees soft. Just another 15 seconds. Push. 10 seconds. You've got this. Hang in there. Pull out on that band. Plug the shoulders down. Keep your focus up. Counting you down. 5, 4, 3, 2, 1. 20 seconds. Take those 20 seconds. Remember, you're going to switch the weight to your non-dominant hand, which means the opposite leg will be leading. So make sure you make that change. We got 10 seconds before we go again. Don't lock your elbows out when you pull out on that band. 5, 4, here we go. 3, 2, 1. Stepping up, up, down, down. Arms raised as you step up. As you step up, the pelvis reaches down to the floor in opposition, lengthening the QL and side body. As you lower, the inner thighs pull back to help you lower carefully with control. Your legs stay parallel, your chin stays lifted, gaze soft. Imagine my hands hovering from your shoulder blades. Go ahead and puff them back, the shoulder blades and back ribs back, feeling that upper back working, doing the motion instead of the front of the shoulders. You're doing great. How quick can you go? Elevating that heart rate, using all of your posturally weak muscles, the adductors of the legs, the abductors of the arms, abs, counting you down. And 5, 4, 3, 2, 1. Great job.